Hello, and welcome to my YouTube channel dedicated to increasing awareness for ADHD and other learning disabilities. My name is Kirtan Patel, and it is my sincere wish to have a positive contribution to the world by producing informative content on ADHD and other learning disabilities and how they impact the lives of numerous children. I hope, having watched my videos, that my viewers have a newfound perspective on ADHD and learn more and how it impacts so many children and teenagers. I would like you all to aid my endeavor by subscribing to the channel and sharing and liking this video. By listening to my interviews and the informative experts that volunteer their precious time so I can interview them, I hope we can help people who have ADHD and their family members. I live by the ethos: in the joy of others lies our own, in the progress of others rests our own, and in the good of others abides our own. My guest today is Dr. Lynnika Jones. Hello, Dr. Jones.
Hi, how are you?
Good. Welcome to my channel, and thank you for volunteering your time to share your expertise and experiences with ADHD with my viewers. Dr. Jones is a licensed school psychologist currently working for Denton ISD and a licensed professional counselor providing counseling in nursing homes and assisted living facilities. Additionally, she assists in completing psychological medical clearance evaluations for care clinical services. Dr. Jones completed her undergraduate studies at the University of Tennessee in Knoxville, Tennessee. She earned her master's degree in professional counseling at Argosy University and her PhD in school psychology with a concentration in neuropsychology at Texas Women's University. At Texas Women's University, Dr. Jones was trained in psychoeducational assessments, functional behavior assessments, behavior intervention plans, consultations, and neuropsychology. Dr. Jones completed her APA accredited internship at the Illinois School Psychology Consultorium, where she was trained in school-based assessments, individual education plans, school-based intervention plans, and school consultation. She also completed her postdoctoral fellowship at Fort Worth ISD. Dr. Jones' areas of interest include counseling students at the elementary and high school levels, counseling geriatric populations, anxiety, depression, personality disorders, and assessments. Welcome to the channel again. Your expertise will be valuable.
Thank you.
The power of listening to others and caring is immeasurable. The Dalai Lama opined, as human beings, we each have a responsibility to care for humanity. Expressing concern for others brings inner strength and deep satisfaction. As social animals, human beings need friendship, but friendship does not come from wealth and power, but from showing compassion and concern. With these powerful sentiments at the forefront of our thoughts, let's dive into today's interview. Dr. Jones, what are the most common effects of ADHD you've seen in children?
Honestly, I see a lot of effects. Usually there's issues with time management. A lot of times we'll see children having just the emotional dysregulation, like it's hard for them to calm themselves down when they need to, like it's hard for them to focus on certain tasks. So in the educational setting, we can see a lot of difficulty at times, especially when people don't understand what's going on.
Can you elaborate upon what emotional dysregulation is?
Sure. So for most of us, like when we feel upset or we feel a certain emotion, we're able to like calm ourselves down pretty easily. Sometimes someone with ADHD, it's a little more difficult. They may struggle with just in that moment, just being able to calm themselves back down. So it might be something where they might shut down. And I don't know if you've ever experienced that, but sometimes if you get frustrated or you're having to move on to another task and you're not quite ready to, sometimes we'll see a shutdown. Sometimes we'll see people get a little more frustrated or maybe a little more angry than maybe we think they should, because it's just hard for them to like just get into that moment. So that happens often.
Definitely, I've been through that.
Yep.
What techniques have you seen used to help children with ADHD do better in their studies?
So, like I said, I work in the schools, and so we have two programs. We have one that is called 504. I'm not sure if you've heard of that, but a 504 plan, and then an IEP. So that's like an individualized educational plan. So a lot of times when students are struggling in the schools, we'll see that that's kind of when I come along, and I'll come and I'll do an assessment, and I'll give a whole bunch of different evaluations and just kind of see like what the areas of difficulty are. So, and then what will happen is we write what I call, like I said, the IEP. We'll write that, and we'll come up with the best way to serve that student. So, like, when we go into schools, there's a curriculum and we all learn the same thing, but some students learn a little bit differently. So, what I do along with other teachers and other, like the administration, we get together and we just kind of come up with better ways to help the student. So, like, there might be where you get more time. Like, maybe it just takes you a little bit longer. To finish a task, and that is something that happens with ADHD a lot. So we might be able to give you extended time, or I don't know, like if you might have experienced this, but sometimes like having multi-step directions. So when someone tells you, okay, go do this, now after you're done with that, go do this, go do that, it's a lot. So we might say, okay, you need to break those down to smaller tasks. So I might say, okay, Kirtan, you go and complete, I don't know, 1 through 5, and then I'll wait and then tell you the next step. So that way you're not overloaded with too much information.
So, do you think that children with ADHD are necessarily disadvantaged in the public school system?
I would say when there's a lack of understanding, it can be. I mean, luckily we do have the federal programs that do help. So, um, like I said, like the IEP, that's under special education. So there are actually programs that do focus on these. But I think like sometimes we do have teachers who just may not quite understand what's happening. So it might look like a student who just is not doing their work, or a student who is like not motivated to do what they're supposed to, but actually it's ADHD, is something that they really can't help. So I think that it can be a disadvantage if knowledge is not there. But I think with more knowledge and like exactly what you're doing right here, this is going to help people understand what really is happening. So this is a really good thing you're doing.
Yeah. So, what advice do you have for students for maximizing their potential?
I think again, knowledge. I think learning about the disability, and I don't even want to call it disability. Let's just say your difference in learning. I think that having that knowledge and knowing yourself, that really helps. So, like maybe for you, using a planner might help you. Like me being more. I know for myself, like I said, I have ADHD, and I'm so not organized at all. So for me, like I'll have planners, or I'll have like multi things to try to help me remember what I have to do. So I'll have a planner. I'll have an alarm in my phone. So just kind of figuring out what works best for you, and just knowing that it's kind of trial and error, and that you'll figure out what works, and then maybe it'll work for a while and then it won't, and then you'll figure something else out. So I say knowledge, like we always say, knowledge is power.
Do you find that ADHD and other learning conditions cause stress and anxiety?
Absolutely. Again, I definitely feel like when you don't have the knowledge, it definitely does, because I think you can compare yourself to others. They're like, well, how come it takes me so long to get this done? Or why can't I, do a task as quickly as everyone else? So I think it can be stressful. But again, I think having the knowledge and understanding what's going on and why you're how you are and all those types of things, I think it really helps. But it can be very stressful for
Yeah,
sure.
absolutely agree. It's very important for students with ADHD to stay engaged and motivated, not become detached. Once the negativity sets in, it's going to be very challenging to regain focus. So, how should the students manage that anxiety and stress?
I think definitely again knowledge. I'll keep saying that the knowledge. I think having a good support system also helps, and just remembering that you don't have to be perfect. That everybody is different. Though you might have a disability, like your disability might be ADHD, but there might be someone who has a reading disability, or there might be someone who struggles with depression. I mean, we all kind of struggle with different things. I think so. Realizing that no one has to be perfect, and that it's just all about learning yourself and learning what you're better at or what helps you, that I think that would help definitely.
Yeah, I would agree that being adaptive to change techniques can help students reduce stress and increase efficiency and productivity. Dr. Jones, thank you for your insight and advice.
Of course, anytime.
I am sure my viewers will find your advice helpful as they navigate through thriving and managing their ADHD. I hope you have enjoyed my interview with Dr. Jones and would encourage you to like, share, and subscribe to my channel. I would like to leave you all today with a quote the legendary founder of Apple, Steve Jobs. It's entitled Crazy Ones. Here's to the crazy ones, the misfits, the rebels, the troublemakers, the round pegs in the square holes, the ones who see things differently. They're not fond of rules. You can quote them, disagree with them, vilify them, or glorify them. But the only thing you can't do is ignore them because they change things. They push the human race forward. And while some may see them as the crazy ones, we see genius. Because the ones that are crazy enough to think that they could change the world are the ones who do. With this insightful quote in mind, I hope interviews like this will help those with ADHD know that their abilities are unique and that they have the power to change the world too. Let's celebrate unity in diversity. I hope to see you all again for another interview and more content on increasing awareness for ADHD. Thank you for listening.